The ability to identify specific patient populations, for example, those with heart failure, has become an imperative for many hospitals. In order to provide optimal care and reduce readmissions, it is essential that accurate value sets be created, maintained, and leveraged. It's a task easier said than done. Typically, clinicians and analysts collaborate on the creation of value sets, sourcing and validating hundreds of codes. These codes also require extensive formatting before importing into the EHR. It is a painstaking process that can take weeks, if not months, to complete. Why not leverage IMO Precision Sets instead? Simply visit the IMO Precision Sets web portal and select the set you need. Either click on the spreadsheet file to review the codes or download the text file for importing directly into the EHR. Now, when a member of the patient cohort presents, the EHR can trigger the implementation of an appropriate care plan. Of course, as time passes, standard code sets get updated, impacting the accuracy of value sets. If your value sets aren't in sync with code updates in your EHR, patient safety might be compromised. Maintaining and syncing value sets can be just as resource-intensive as creating them. At least it used to be. IMO Precision Sets leverages the power of the IMO terminology portfolio, which contains millions of clinically friendly terms mapped to diagnosis and procedure code sets that are vetted by IMO's team of clinical experts. Every time IMO terminologies or standard code sets are updated, IMO ensures IMO Precision Sets and the IMO terminology portfolio update together. This dramatically reduces both risk to patients and the burden of maintenance. Simply visit the IMO Precision Sets web portal and download the updated set. IMO Precision Sets meet the demands of outcomes-based care while avoiding the inaccuracies, resource drains, and inefficiencies of DIY approaches.